Hello everyone, I am Dr. Ravina, NHS doctor specialised in women's health, and I'd like to welcome you to this dedicated channel for women's health. Today we'll be discussing preconception screening, and this is one episode in a series of episodes on planning your pregnancy. So whether you are at the beginning of your fertility journey, you're thinking about getting pregnant in the near future, or perhaps you're already on that journey and you're currently trying to conceive, then this is information for you. We will be giving you all the top tips and evidence-based information backed by the NHS NICE guidelines, the Royal College of Obstetrics and Gynecology, and all of our information is backed by current research. If you have any questions, feel free to drop them in the comments below. We want to encourage an open conversation and we want to answer your questions. So feel free to send me any questions on Instagram at dr.ravina, and of course share this with the people that you love so that we can increase the knowledge in women. So today we'll be talking about how we can ensure that you are in optimum state to reduce pregnancy complications and risks to your baby. So we're going to be talking about a few screening tests that you should do before you get pregnant so that we can ensure that you are in the best state. The first thing is a cervical screening test. So you will get called every 3 years from the age of 25 to go for a cervical smear, also known as your smear test. And we've done a whole video on this to tell you what to expect during your smear test, so feel free to check that out. So if you are planning a pregnancy, it's really good to make sure that you're up to date with your smear test. And this is because during pregnancy, we don't advise for you to have a cervical smear during your pregnancy or up until 12 weeks postpartum, so at least 3 months after you have delivered your baby. Now you will get called for your cervical smear when it is time. You will get either a letter in the post, or you might even get a text on your phone to remind you to go to your GP, book an appointment with the nurse to get your cervical smear done. As I said, this happens every 3 years, but maybe more often if there's any abnormal results and we need to follow you up sooner than the 3 years. However, if there's no reason for us to do it in a smaller amount of time than the recommended 3 years, then we won't offer it to you, and then we would just follow you up after you've completed your pregnancy. So what happens if you do have an abnormal smear and you need to get rechecked? So if you're pregnant and have an abnormal smear, you may get called to go to colposcopy, which is where you go to a specialised gynecological clinic, you sit on a colposcopy chair and we'll look inside the vaginal canal to have a look at the cervix. We may look at the cervix underneath a microscope and then take some samples of the cells if there's any abnormalities. In these specific and very unique examples, we will then continue with colposcopy, and this is only the case in less than 10% of cervical smears. Generally in pregnancy, we wouldn't do this. Furthermore, if you need treatment, then we will also send you to colposcopy if you do have an abnormal smear. Number 2, chlamydia screen. Now, chlamydia is one of the most common sexually transmitted infections or diseases in the UK, and it's one of the most common STIs in people under the age of 25. Many people will have chlamydia and not actually know they have it because they may be asymptomatic. Some of the symptoms to expect if you do have it would be abnormal vaginal bleeding, abnormal vaginal discharge, painful sex, abdominal pain, smelly discharge. And if you have any of these symptoms, please do talk to your doctor. However, if you are thinking about getting pregnant and are worried about chlamydia, then we would suggest doing an STI check. And this is because any STI can cause infections to your pelvis, known as pelvic inflammatory disease. Furthermore, if you have chlamydia whilst you're pregnant, it can cause complications to your baby during delivery. It can cause neonatal pneumonia in your baby, which is a respiratory lung condition, and it can also cause neonatal conjunctivitis in your baby, which is also quite serious. So we would rather screen for this early and prevent this from occurring in your newborn. If you were to have chlamydia and you were to test positive, it's important to undergo partner notification. And this is what we call letting your partners know. So any recent sexual intercourse, whether it's one partner, several partners, you should let all of these people know if you have then tested positive for chlamydia, because this can affect both men and women, and it has consequences on your future fertility. Furthermore, some people think there's a stigma associated with chlamydia, but actually if we just talk about it and notify the relevant people, it can very quickly and simply be rectified and treated with antibiotics, and it doesn't have long-lasting consequences if it is treated early. The third type of screening is the rubella screening. So rubella in pregnancy, specifically in the first trimester, can increase the risk of fetal loss. It can cause fetal abnormalities, specifically the congenital rubella syndrome. And if you want to know what this looks like, you can Google it, but it really can cause some detrimental effects to your baby. Most people that are born in this country will be offered the MMR vaccination, which will cover you for rubella. But if for whatever reason you were not vaccinated, you weren't brought up in this country, so perhaps haven't had the UK vaccination schedule as a child, then it is important for us to check whether you've had rubella. We'd advise for you to get the MMR vaccination before trying to conceive. There's 2 doses, they need to be 1 month apart, and then you need to have another month after you've had your last dose before you try to conceive. If there's no history of your vaccination, if you're not sure whether you've had it, then speak to your doctor and we can then organise for you to get an antibody test to check whether you had rubella, then had the subsequent antibodies as a result of it. If you test positive, that means you have antibodies and are immune to rubella, so you won't need the vaccination. But if you test negative, that means you don't have any immunity to rubella, and we would suggest you get the rubella vaccination. So other screening that we'd recommend would depend on your individualized case, depending on your past medical history, your risk factors, your ethnic background, if you've got any underlying conditions. So these would be, first of all, bloodborne viruses like HIV, hepatitis B and C is something we'd like to screen for, and these are generally done in your booking visit. So this is your first visit once you become pregnant, usually between week 8 and 12, and we would screen for all of these things at this point. It is important for us to screen this beforehand if you are likely to be at risk of this. If you are found to be HIV positive, then you would be under specialist care by HIV specialist doctors. You may also be under obstetric care and have your appointments done in hospital rather than in the community with a midwife. The reason why we need to give you special care is because we want to reduce the risk of vertical transmission. Vertical transmission is the transmission of viruses from mother down to baby. If we can control HIV, the risk of HIV then being transferred to the baby is less than 1%. You may be at higher risk of hepatitis B if you've been in contact with people who may have hepatitis B, and also if you've had a change and had multiple sexual partners. Another thing that we'd like to screen for is any problems with your red blood cells, specifically with your hemoglobin. So if you are someone who may be at risk of sickle cell anemia, you may already know this if you have a family history, or thalassemia, we'd need to know this as there's a risk of you having further anemia during pregnancy, and then during delivery you may be at higher risk of postpartum hemorrhage and then require a blood transfusion. So we like to know what risk you have and whether we can mitigate that risk earlier on. We like to know if you have any vitamin D deficiencies, because we can then replace it with daily tablets, and that can help strengthen your bones for not only you, but then also your baby throughout their childhood. The last thing that we need to check for is varicella, also known as chickenpox. And so many women don't actually know if they've had chickenpox, which I find so surprising, because I remember when I was so little and I had chickenpox and I was itching all over, and it was so traumatic that I would never forget it. However, some people just don't remember, especially if they're quite young, when they contract chickenpox. The reason why we need to know about varicella is because the consequences of pregnant women getting varicella are huge. Women are already immunosuppressed, which means their immune system isn't as strong as it would be pre or post pregnancy. Therefore, we want to screen for varicella. If you're not sure whether you've had chickenpox before, then we would advise for you to talk to your doctor so we can then test you, check if you've got any antibodies, and if not, then we would offer you the varicella vaccination. Just as the MMR vaccination, Same with varicella, we would need you to have a month after the vaccination before we advise you to try to conceive. The risks of not checking whether you've had chickenpox and then also not having the varicella vaccination means that during your pregnancy you would need to stay away from children or anyone that have chickenpox, as this can predispose your baby to getting fetal varicella syndrome, which is a really horrible condition, and it can cause quite significant consequences to your baby. So the key screening tests that you need to check for before you get pregnant are an STI check, a cervical smear, your rubella status, your varicella status, so whether you've had chickenpox or not. I suggest talking to your mother and also maybe your siblings if you've got an older sister, to see what sort of complications they had in their pregnancy. Especially if your mother had had preeclampsia or gestational diabetes, it's really important we know this, as this puts you at higher risk during your pregnancy. Not only is it important to find out about the physical health, but also we want to know about mental health. So any case of depression, postpartum depression, we really want to know this so that we can help support you during your pregnancy. It's also important to do a HIV test and also to ensure that you've got optimum weight. And we go into all the factors that affect conception in a different video, which you can check out next. So that concludes today's video on the key screening that you require before trying to conceive. If you have any issues or any problems that you want to discuss, please drop them in the comments below. Until next time, take care. Bye.